This is Dr. James with Helpmommy.com, and this video 2 of 5 for a 4-month. And we're going to talk about peeing and pooping. So peeing at this age is really not any different than the other ages before. These babies pee a lot, and that's because their diet is mostly liquid, and they drink a lot more than they actually need for fluid intake. What I mean by that is drinking milk as your only source or your main source of food is a very inefficient way to get food. So you have to drink a lot of it compared to what you actually need for hydration. So they're over drinking, therefore they will be over peeing. So there's still a lot of wet diapers. Now, when we start solid foods, baby foods, you will change baby poop. Who knows what color it's going to come out? And the color that comes out does not usually have any correlation to the color that went in. Stool is really kind of a byproduct. It's things that you wanted to get rid of, and you'll excrete that through your liver and gallbladder and things like that. But it's also what you didn't need, so you didn't absorb it. You've probably noticed that baby poop has changed over the first 4 months, and you were feeding the baby the same thing every day. Why would it change? Again, it depends on what they need to get rid of and what they didn't need that day. Well, that's going to be even more with foods. And so who knows what color it's going to be. Again, there should be 3 colors that you should worry about. We shouldn't see any black or red. That would indicate blood. And we don't really want to see white, which means that we're not usually absorbing fat. This is also a time where sometimes we can see some constipation, where the stools get hard and they may be painful. We have found that baby to baby, there's certain foods that are more constipating. They tend to get more constipating when we do things like bananas. Whereas there are certain foods that will usually clean them up, like they're gritty fruits like pears and prunes, peaches, apricots. And so sometimes we'll use that to our advantage. If we have babies that have hard stools, we may do some of those fruits to help clean them out. We may even use the juices for those fruits. So a lot of times we'll use things like pear juice or prune juice. But that's something that usually your doctor is going to tell you about. But we can see hard stools, and we don't want hard stools to persist. For one, they hurt the baby. But the other thing is, prolonged hard stools can eventually lead to problems with chronic constipation, encopresis, and problems potty training your baby. So if we start to have hard stools, if it's just 1 or 2 hard stools and it goes on and it takes care of itself, then this is just a transition thing. But if this is something you're seeing, this is something you need to contact your doctor about, and they need to help you through this so we don't have a baby that's hurting every time they poop. So that's what's happening. Pee, pretty much normal. Poop, going to be changing. Lots of different colors, lots of different smells, and sometimes some transient constipation. But for the most part, they should be having quite a few diapers, 8 to 12 usually, maybe even more. We should be having normal stools. We want them kind of the consistency of frozen yogurt, a little less firm than peanut butter usually. If they're coming out hard and firm, that's something that could be hurting your baby. And we shouldn't see stools that are red, black, or white. Hope that helps you. If you like these, please like, follow us. If you like longer videos on these topics, please check out Helpmommy.com. It's completely free. And if you like the way I teach, please go on Amazon, check out my book, The Big Book of Why for Parents. Have a great day.